Good afternoon. My name is Inez Ponce, and I'm the director here at the UCLA Center for Health Policy Research. Welcome to today's online seminar, Pride and Pandemic, Vulnerabilities to COVID-19 Among LGBT Adults in California. We welcome our special guest today, Catherine O'Neill, who is a policy fellow and analyst at the Williams Institute at the UCLA School of Law, the leading research center on sexual orientation and gender identity, law, and public policy. She led the production of 2 groundbreaking reports on economic and health vulnerabilities of adults in the LGBT community using our 2015-2018 California Health Interview Survey data and Ask CHIS online tool. The talk today is especially relevant since we are wrapping up LGBTQ Pride Month, which, like many other celebrations, is being impacted by COVID-19 with the cancellation of gatherings and other in-person events. It has impacted every layer of our social and economic fabric, shining a light on inequities in health and beyond, and particularly on people of color and other vulnerable communities. California is home to nearly 15%, or 1.7 million, of all LGBT adults in the United States, of which more than 200,000 are at high risk for the COVID-19 illness, according to the Williams Institute studies. Catherine will walk through report findings which show that LGBT adults in the state are significantly vulnerable to health and economic harm due to COVID-19. Among those vulnerabilities, more than 200,000 LGBT people in California have one or more high-risk medical conditions, including asthma, diabetes, heart disease, or HIV. 612,000 were living below 200% of the federal poverty level prior to the pandemic, and 134,000 do not have health insurance. Additional health factors include problems paying for medical bills and delaying or forgoing care because of cost or lack of insurance. And economic risks are related to factors such as poverty level, race, ethnicity, gender identity, housing, food security, and employment status. These factors are all covered by the California Health Interview Survey, CHIS, and are vital to delve into when looking at barriers to healthcare and access. If you're interested in today's slides, you can request them from our communications department at the email address shown on your screen. And please stay tuned for announcements on our upcoming seminar on Thursday, July 16th, on a case velocity model for predicting COVID-19. This will be held with Christina Ramirez, a professor of biostatistics at the UCLA Fielding School of Public Health. Now let's begin today's discussion with Catherine O'Neill. Catherine?
Thank you, Inez, for that generous introduction. And thank you to the Center for Health Policy Research for hosting this webinar today. I'm excited to have the opportunity to share the results of these reports. And thank you all for joining this webinar and for your time and interest in this topic. So I'll present for about 30 minutes, and then there will be time for questions at the end. But you're welcome to add your questions to the chat as I go along, and the moderators will keep track of those. As Inez mentioned, these reports on the health and economic vulnerabilities to COVID-19 among LGBT adults in California describe characteristics of this population which are relevant to the pandemic and the attempts to contain it. There are about 1.7 million LGBT adults in California, which is about 15% of the entire LGBT population in the United States. This is over 1.5 million lesbian, gay, and bisexual cisgender people, as well as 109,000 transgender people of any sexual orientation. I also want to mention at this point that I say LGBT in this case instead of LGBTQ or QIA, because the data I used didn't include an option for people to identify as queer or other identities, but I expect many of these findings apply to them as well. As you may be all too aware, California has a significant number of COVID-19 cases. As of June 25th, California has over 200,000 cases and over 5,800 deaths. This is the second highest number of cases among US states after New York. This number has increased significantly since these reports came out in mid-May. At that point, California had half this number of cases and had the 5th highest number among states in the US rather than the 2nd highest. At this point in the pandemic, we're aware that there have been some significant disparities in who COVID-19 has impacted the most. For example, we know that Black adults are disproportionately getting sick and dying from COVID-19 after a long history of oppression, discrimination, and barriers to healthcare. We do not yet know, however, whether disparities exist along other axes of identity, including sexual orientation and gender identity, both within the Black population and among other racial and ethnic groups. This is primarily because COVID tracking systems are not currently collecting this data. However, California is currently considering a bill, SB 932, which would require COVID monitoring systems to collect sexual orientation and gender identity data along with existing demographic data, such as race, ethnicity, age, and sex. Several other states are considering collecting this information as well, and at least one state, Pennsylvania, is already collecting it. Before I get into the results, I want to give some context for where this data is coming from. So it's important to note that this is a snapshot of the LGBT community from before the COVID-19 pandemic. Data come from the 2015 to 2018 California Health Interview Survey. And as I mentioned, we don't yet have statewide data since then about the impact of COVID on the LGBT community. Once we do have that data, whether from that California bill or through future releases of CHIS data, we look forward to examining some more concrete information on what impact COVID has had on LGBT people. So the California Health Interview Survey is the largest state health survey in the US and is conducted continuously, interviewing over 20,000 Californians every year. It's conducted by the UCLA Center for Health Policy Research, who is our host for this webinar today. I am grateful that they collected this data and made it easily accessible for the responsive work like this through their online Ask CHIS tool, which you see here and which is what I used. So I'm first going to give an overview of demographic characteristics of LGBT adults in California before describing health and economic vulnerabilities related to COVID-19. I also want to mention that all these demographic characteristics, along with the rest of the results, are limited to those over the age of 18. So LGBT adults live across the state. The majority, about 92%, live in urban areas, while over 130,000 live in rural areas. Large numbers are concentrated in Southern California, and about a third of the LGBT population in California lives in Los Angeles County itself. And if you want more detail here, in the reports, I list out the estimated population for each specific county. So happy to go into more detail if you're interested. So the concentration in LA County is of concern right now because many of the cases in California are concentrated in Los Angeles, of the COVID-19 cases. So on the left, we have a bar graph of the number of cases in each county, and you can see that top line is Los Angeles County, and it has about 90,000 cases. This data is from the California Department of Public Health as of June 25th. And so you can see that about half of cases in California are in LA County. Moving into race and ethnicity as well as age. LGBT people are represented among all racial and ethnic groups. LGBT people of color face some intersecting disadvantage, which I will describe in more detail later in the presentation. And then looking at age on the right, we are aware at this point that older adults are more susceptible to severe illness from COVID, and there's over 300,000 LGBT adults in California who are over the age of 55. But then also many LGBT adults are young, as younger people are more likely to identify as LGBT. And so that's where you see those high numbers under the age of 34. Here we have citizenship and gender. So citizenship on the left, many LGBT people are not US born. Those who are non-citizens in particular face challenges. That's about 9% in California. And these are both economic and health related challenges associated with accessing resources and benefits. This is especially true for undocumented people, though the category of non-citizen includes both undocumented people and those with various types of visas. On the right, we have gender. LGBT adults in California are slightly more likely to be female. Transgender people may identify as women, men, or another gender identity, but we aren't able to break down those groups here. Their prior research suggests, though, that their experiences are distinct in important ways, and that's an area for future research. Later in the presentation, I'll describe some of the ways that all of these characteristics intersect with health and economic challenges during this pandemic. Moving into health vulnerabilities. One of the first things we can look at when looking at the health of a population is self-rated health. So respondents are asked to rate their own health from excellent to poor, and lower self-rated health is a known predictor of mortality and other poor health outcomes. Previous research has found, unfortunately, that LGBT people are more likely to have fair or poor health on the right of that graph. Next, the CDC has identified illnesses that make people more likely or more susceptible to severe COVID illness. So here we have asthma, diabetes, and heart disease. Of course, these are some of the characteristics that were identified a little while back while I was working on these reports. And the CDC has since identified other factors that also contribute to risk that are not represented here. So many LGBT Californians have these three illnesses. Over 200,000 have asthma, over 114,000 have diabetes, and over 80,000 have heart disease. And prior research shows that LGBT adults are more likely to have these three illnesses than their cisgender and heterosexual counterparts. These disparities reflect some of the impact of minority stress on LGBT people, as well as disparities in healthcare access and social determinants of health. It's also important to note when looking at these numbers that people of color also disproportionately face some of these risk factors because of systemic lack of access as well as discrimination. Moving into HIV, the CDC notes that those who are immunocompromised, such as those who have uncontrolled HIV, are at particularly high risk during this pandemic. LGBT people, particularly men who have sex with men, that's that MSM acronym there, they continue to be the population most affected by HIV. These data do not come from the California Health Interview Survey. They come from the California Department of Public Health Office of AIDS as of 2017. And over 130 adults in California have been diagnosed with HIV, about 3/4 of which, 75%, are men who have sex with men, and 1.3% are transgender. So that's over 100,000 people in California. Couple of other health vulnerabilities to consider. Over 200,000 LGBT Californians live alone, and prior research suggests that LGBT people are more likely to live alone than non-LGBT people. And during our social distancing efforts, that increases people's isolation. And additionally, over 500,000 LGBT Californians have a history of suicide ideation. So this is over 30% of LGBT adults in California. To give you some context for that number, in contrast, about 10% of the general population in California has a history of suicide ideation. At this point, there's limited evidence so far, but a great deal of concern about whether suicide rates and risk are changing, because many people are concerned that documented risk factors for suicide are increasing, including isolation, job loss, and financial stress. And so as we see those things go up, there's reason for concern for vulnerable populations when it comes to suicide. Moving into healthcare barriers. So these are 3 cost-related healthcare barriers. On the right, we can see that over 130,000 LGBT adults in California are uninsured. Over 230,000 have had problems paying for medical bills within the last year, and about 150,000 have had to delay or forego needed medical care because of cost or other insurance-related concerns. Access to healthcare is critical in a pandemic, and this is especially true for those with pre-existing poor health. As I mentioned earlier, we saw that LGBT adults are more likely to have fair or poor health than their non-LGBT counterparts. And these Costs and insurance-related barriers are particularly salient for those who have lost their jobs and potentially their health insurance in recent months due to some of the economic consequences of this pandemic. And I'll get more into those in more detail in a moment. Along with cost-related barriers to healthcare, there are also discrimination-related barriers. So some of you may be aware of the recent rollback of gender identity non-discrimination protections by the US Department of Health and Human Services just a few weeks ago. Fortunately, California has state laws which ban discrimination based on gender identity in healthcare. But regardless of these policies, many LGBT people, especially transgender people, face discrimination and other negative experiences in healthcare settings. In a prior study, the United States Transgender Survey, which was looking nationally, about 1/3 of respondents who had seen a healthcare provider in the last year reported having at least one negative experience related to being transgender. All right, so next I will describe some of the economic challenges faced by LGBT adults in California. And as we look at these challenges, I want to note that these two domains are related. So socioeconomic status, for example, is among the most important social determinants of health, including, helping with access to health insurance and things like that. So first, poverty is an important measure of socioeconomic status. Over 600,000 LGBT Californians live below 200% of the federal poverty level. This is about 36% of all LGBT people in California. This percentage is similar to the overall rate of Californians earning below that cutoff. And then we use that cutoff, 200% of the federal poverty level, because that's commonly used in California to identify low-income households due to California's high cost of living. And to give you some context for what that means as far as income, in 2018, 200% of the poverty level was about $50,000 for a family of 4. So of those earning below 200% of the poverty level, about half, or 300,000, face food insecurity. And then as we think about poverty, we want to consider that within the category of LGBT, there's some significant diversity of risk factors and experiences when it comes to poverty. Additionally, some prior research shows that LGBT people, especially transgender people, have higher poverty rates than non-LGBT people, both in California and in the US as a whole. So here we can look at poverty by race. So the yellow portion of each bar is the portion of each group which earns below 200% of the poverty level. And we can see that poverty is concentrated among people of color. So LGBT Californians who are people of color face some intersecting disadvantage and may experience higher levels of discrimination and lack of acceptance. In particular, Black, Latinx, multiracial, and Native people face particularly high levels of poverty. Here we have poverty by gender. So women in general have higher poverty rates, and bisexual women and transgender people in particular have some of the highest poverty rates among LGBT people. Here we can see that this estimates that about 45% of transgender people, for example, in California are at or near poverty. And as I mentioned before, some previous research suggests significant differences between trans men and trans women and those outside of the binary, but we don't have the ability to break down those groups here. So this chart describes poverty by age. So in a previous slide, we saw that many young people are LGBT. And here we can see that younger Californian LGBT adults have higher poverty rates. So among 18 to 24-year-olds, it's about 45%, for example. And if we were to look at just those yellow bars, so just the portion of the population that's under 200% of the poverty line, about 2/3 of those people are under 34 years old. Additionally, younger adults may be more likely to experience significant job loss, as they're more likely to work in higher risk industries and positions. And I'll get into those industries in a few slides. Next, we have poverty by citizenship. So on the left, we have US-born citizens and naturalized citizens. These two groups have similar poverty rates at about 34 and 35%. And then on the right, however, we can see that over half of non-citizens earn below 200% of the poverty line. Non-citizen includes both undocumented folks and those with various types of visas. And that 55% translates into about 83,000 LGBT non-citizens in California who earn below 200% of the poverty level. These people may face more challenges accessing government benefits, such as those provided through the CARES Act, and this would be particularly pronounced among undocumented residents and those living in mixed status households. Non-citizens may also avoid benefits even if they are eligible due to fear about public charge rules or deportation. So now we can look at employment. And again, I want to emphasize this is pre-pandemic employment. And prior to the pandemic, 2015 to 2018, about 1 million LGBT adults were employed full-time and about 140,000 were unemployed and looking for work. A substantial amount of previous research describes employment disparities between LGBT and non-LGBT people. Of course, as we look at these numbers, it's very likely that employment looks very different now, considering the economic consequences of the public health response to the pandemic. As of the May 2020 jobs report, employment in the US as a whole is still 13% lower than in February of 2020, with about 20 million fewer jobs. Here we have employment broken down into 5 industries. And these are 5 industries that the Bureau of Labor Statistics has identified as industries that are experiencing significant job loss during this pandemic. So that's education, healthcare and social assistance, retail, leisure and hospitality, professional and business services, and construction. They're all experiencing a substantial amount of job loss right now. And altogether, about 814,000 LGBT Californians worked in these industries. And then to break down what some of these categories mean, within leisure and hospitality, that includes restaurants, hotels, and entertainment. And then within healthcare, for example, the Bureau of Labor Statistics surveys find that job loss in healthcare is occurring among nurses, technicians, and medical assistants that work in non-hospital settings, such as doctors' offices and dentist offices. And job loss in social assistance is largely stemming from daycare closures. So here we have those same industry categories, but broken into the portion of each industry which earns below 200% of the poverty level. So again, that yellow portion of each bar. Altogether, about 250,000 LGBT adults in California working in these industries earned below 200% of the poverty level. That's about 30%. 30% is a little bit lower than the overall LGBT poverty rate, which I mentioned earlier at 36%. But that makes sense considering some of the high paid jobs in some of these categories. But if you look at each industry, some have very high poverty rates, including retail and construction. And of course, job loss among those who are already low income and working in these industries will cause significant hardship during this pandemic. Here we have housing. So housing status is of concern in California, considering the high cost of housing and the large numbers of homeless in many regions. Here we have numbers of those who rent versus own their homes among LGBT adults. Many Californians are housing burdened, meaning they may be at risk of eviction and foreclosure when pandemic grace periods end. Housing burdened means that they pay over 1/3 of their income on housing costs. And while Governor Newsom's orders to delay evictions and provide mortgage payment grace periods provide some temporary relief, many households may struggle to pay past due rent after those grace periods end. Additionally, I mentioned earlier that over 250,000 LGBT adults live alone, potentially creating additional precariousness for single earner households. And additionally, some households may be less likely to access government protections and grace periods, especially non-resident or mixed status households. So to summarize what I've described so far, I've given a profile of LGBT Californians with an eye to COVID-19 related challenges. I've described health vulnerabilities, including self-rated health, health conditions, including HIV, asthma, diabetes, heart disease, and suicide history. We looked at both cost-related and discrimination-related barriers to healthcare. And then within economic vulnerabilities, we looked at poverty, employment, both overall and within impacted industries, and housing. And we looked at some of the ways that these vulnerabilities intersect with sexual orientation, gender identity, age, race, ethnicity, and citizenship. So for example, we know that poverty is concentrated among young LGBT people, people of color, those who are not citizens. Many employed in impacted industries were earning below 200% of the poverty line. We also saw that LGBT adults face cost and discrimination-related healthcare barriers and are more likely to experience health conditions, which may make them more susceptible to COVID-19 illness. So one implication of this work is that interventions are needed for this community. There are clearly large numbers of LGBT adults in California who are positioned to have substantial need during this pandemic. Long-term interventions should address the disparities experienced by this population, but emergency relief and social services are also needed more immediately to reach out and ensure that they are welcoming this community. These results also reflect the need for more data and work on this topic. So it would be great if that California Senate bill that I mentioned passed and we were able to have more timely and immediate data on the impact on this community. We will also look forward to analyzing future CHIS data. So once we have those 2019 and 2020 years, we'll compare before and after the pandemic. And then it would be also really important to be able to do this work on a national scale. So if national surveys such as the Behavioral Risk Factor Surveillance System, if they collected SOGI data more broadly in different states, we could see how this varies in different places. It's also important to note that California has a really good legal and policy landscape for LGBT people. And despite that fact, we continue to see some health and economic disparities persisting. And so that's part of why the national scale data collection would be important, is to look at the impact of the different legal and policy landscapes. Before I close, I want to acknowledge the guidance of some of my coworkers at the Williams Institute, including Kareth Conran in particular, as well as Brad Sears, Christy Mallory, Bianca Wilson, and Jocelyn Samuels. These are some of the works that I cited. I'm happy to come back to this page if you want to look more closely. And thank you very much. I am ready for questions and discussion.
Thank you, Catherine. Good afternoon, everyone. My name is Tiffany Lopes, and I'm the Director of Communications here at the UCLA Center for Health Policy Research. I will be moderating questions from the audience today. I encourage you to use the Q&A function in Zoom to ask questions. We've got some great questions lined up from the audience, so let's begin with the first question. Can you speak a bit more about the findings around HIV? There is some evidence that suggests people living with HIV and AIDS who are on antiretroviral therapy may be less vulnerable to COVID-19.
So that's a great question. I wish I knew more detail about some of the science there regarding antiretroviral therapy. And I have to unfortunately pass that question on to people who know a bit more. But you know, as I'm sure you know, those who don't have access to antiretroviral therapy may be at increased risk.
Thank you. Can you speak to some of the specific vulnerabilities impacting the transgender community? Are there any efforts to expand research for the transgender community?
Absolutely. You know, both at Williams and in other places, there's a great deal of interest in looking in more detail at the transgender community. One of the biggest challenges is data collection. So there's only a couple of surveys at the national scale, for example, which ask about gender identity. And we need those bigger scale surveys in order to be able to study this population because it's small. So we need to have a big enough sample size in order to do that. So we can do that a little bit with CHIS data. But yes, there's absolutely an interest in doing more research there and looking more closely at the different experiences of different transgender people, whether trans men, trans women, or gender diverse folks.
Thank you. Additionally, is there any interest in expanding this research nationally?
Absolutely. I wish I had CHIS data nationally. That would be wonderful. And you know, in the surveys that do collect sexual orientation and gender identity data, we are trying to do similar reports and ask similar questions, both to just kind of describe the population like I did here and to look more closely at where those disparities exist.
Got it. Another question. The study is really interesting and not something I've read or heard about. Any considerations to collaborate with community clinics such as the LA LGBT Center and other health centers to assess health impact or conduct needs assessments?
That could be really interesting. Please email me. I put my email on the slide, by the way. Please feel free to get in touch if you have questions or you want to follow up on something like that. Yeah, Williams is always looking for opportunities to do more research on, all of these topics.
Is there an intersection between LGBT communities and homelessness that can be explored and assessed as far as this disease and impact on these communities?
Yeah, that's a great idea. I unfortunately don't have, in this study, I wasn't able to look at homelessness, but prior research suggests that LGBT people are more likely to experience, are particularly likely to experience homelessness, especially LGBT youth. And to look, it would be wonderful to be able to look at that and along with the pandemic and see how those two things are intersecting and what that means. And yes, I would love to do that study. If you have connections on how to get that done, let me know.
Sounds like there's a lot of need and a lot more work to be done.
Absolutely.
Another question, what can we do to push agencies who create these local, state, and national surveys to incorporate additional questions on gender identity and sexual orientation? Yeah,
great question. That's something that Williams pushes for a lot is, if a survey exists, and it asks demographic questions, it's often, useful to look at sexual orientation and gender identity as well. And then how do we make that happen? I don't know, we write letters, call up representatives, do what we can.
Definitely. So somebody mentions that they're interested in knowing approaches to mitigate effects in rural versus urban counties.
Could you say that again? Just the different effects on rural versus urban?
Yeah, mitigating the effects in rural versus urban counties.
Yeah, that's a great question. And that's something I was looking at early on when I was writing these reports. Was at the time, the focus was on, city centers, dense places like New York City having these intense outbreaks. But then there was also concern that when COVID-19 reaches rural areas, there are different challenges there. COVID-19 absolutely can spread through rural areas. And when it does, how does the healthcare response work in places like that where there might be, greater distances to go and some more difficult or different barriers to accessing healthcare. So that would be a really good venue for future research, both among LGBT people. We saw that over 130,000 LGBT adults in California live in rural areas, and see how that intersects with healthcare challenges in rural areas versus urban areas.
Got it. Are there any theories about the causation of the disparate impact?
Did they have disparate impact on a certain variable or just in general?
In general.
So I guess it would depend on which venue you're looking at, but if you're looking at health disparities, for example, some of the research suggests that disparities in different health conditions like asthma, diabetes, and heart disease are rooted in things like minority stress. So the different challenges associated with being a minority and not seeing yourself represented and not having, healthcare providers understand what that entails, things like that. That extra stress you have from being a gender or sexual minority has health consequences. So if you have all of this stress for a long period of time, it'll make you more likely to have heart disease ultimately, things like that. So that's one place that a disparity might be rooted, but we could have a different conversation about each of these variables. So please feel free to put that in more detail in a question if you'd like.
Sounds good. Do you have any early data or even LA specific observations about mask wearing and social distancing compliance rates among LGBTQ people versus non?
I don't have that data. So kind of whether LGBT folks are more or less likely to wear masks, I don't know. That's a great question.
Those are all the questions we actually have for today. I just want to thank you all for attending this month's webinar on vulnerabilities to COVID-19 among LGBT adults in California. And a big thank you to Catherine O'Neill and the Williams Institute for this timely study and discussion. We encourage you to read the policy briefs and other publications by the Williams Institute on their website. We will be posting the recording of this webinar online with closed captions within the next 2 weeks. Please visit healthpolicy.ucla.edu. As a reminder, if you'd like a copy of today's presentation, please email us at healthpolicy@ucla.edu. And stay tuned for details on our next webinar on Thursday, July 16th with UCLA Biostatistics Professor Christina Ramirez, who will discuss fusing a case velocity model with a random forest for predicting COVID-19. Have a wonderful rest of the day. Thank you.